Hello, friends and family. Today I want to talk about life after cancer treatment. I'm Jen. Today and every day we talk about my quest to crush aggressive diffuse large B-cell lymphoma, also called DLBCL, stage 4. We're using the R-EPOCH immunotherapy chemotherapy to crush non-Hodgkin's lymphoma. Thank you so much for joining me on the journey today. So, no quote for you today, just Jen's thoughts. Let's get into the daily thought. All right, so I was realizing today that I will always be a cancer patient. I think there's a saying like once a something, always a something. So I think that's very true. Once a cancer patient, always a cancer patient. Now, I think there are kind of levels of cancer patient. Maybe levels isn't the right term. Maybe it is. I don't know. I guess what I'm trying to say is, right now I'm actively a cancer patient. I'm being treated with chemotherapy. I have active cancer and we're trying to crush it. Tomorrow or next week or 3 weeks from now, I'll no longer be being treated. And I guess in June, we'll say you no longer have cancer, or maybe I will. That would be a different discussion. But let's assume it says you no longer have cancer, right? You're clean. I think the term is NED or NED, no evidence of disease, is on a lot of the boards, the threads. That's fabulous, right? But in the back of your mind, you're always thinking, and this is something that's not the case for me, and I'm not sure why. Despite having had cancer multiple times, I've never really thought about it once I've completed. I don't know how to articulate that nicely. Once I've battled through, I've gotten to the other side, they've told me NED, okay? And then I worked on healing. So I guess one thing I'd like to talk about, just a smidgen, is as far as not feeling well from the treatment, it's not realistic to expect that the treatment will stop, right? I'm going to stop the poisonings will stop next Tuesday if it all goes to plan. I'm not going to feel like my old self, in a week or 2 weeks or 12 days. Like typically I get to a certain level, but I will feel okay. But realistically, I kind of equate it to pregnancy, right? It takes you 9 months to have a baby, and your body doesn't just snap back, no matter how old you are, even the youngins. It takes some time for everything to get back where it belongs and for you to feel your healthy, strong self. So some people say for every week of treatment, it's at least 2 weeks of healing. So if you had 3 months of treatment, then you should expect at least 6 months for healing and so forth. There's lots of different, characteristics like this. In any case, in the past, I've battled through the treatment and then through that healing process, post-treatment, and then I've I don't want to say I've erased it, but I've filed it away in my brain, and I don't really focus on the fact that I've had cancer in the past. I'm always grateful to be on the other side of the treatment, and I just go on with my life, living my life. Now, that's not to say I'm not aware. I'm very aware of my body. I always listen to it, and I always bring things to the doctor's attention. I never ignore any symptoms. Sometimes they're like, that's nothing, and sometimes it's something, right? So even this time, I went for that CT scan. I thought it was a waste of time, honestly, in November. I was like, they're not going to find anything. We can't figure out what this pain is. They're not going to see anything on the CT scan. Furthest thing from my mind that I had cancer again. Furthest thing. I thought kidney, I thought liver, I thought all kinds of things. I did not think cancer. I don't know why. So I'm not sure how I filed that away and how I until probably today or this week, I didn't self-identify as a cancer patient, which is odd given my history, but that's the way it was. I think the thing that happened was, and I told you guys about it, I'm not sure how many of you heard it, but it's really been ruminating in my brain. When I was talking to the doctor last week about, what are the possible outcomes of this upcoming PET scan, and he said, well, if there's a refractory lymphoma, then I'm going to send you to Dr. So-and-so because he is the guy for refractory or relapsing lymphoma. And that got me to thinking, man, lymphoma must be refractory or relapsing a lot if there's a specialist for that, right? You don't don't see an oncologist or a lymphoma oncologist. You see a specialized relapsing refractory lymphoma doctor. I'm like, it started to blow my mind. And then I started to read the data. That's a different discussion. But, you know, I have non-Hodgkin's lymphoma stage 4, and the likelihood of refractory or relapse is higher than I would like. And the fact that there's a doctor that specializes in it tells me even more, right? So as a little bit of education, because you know I'm all about that, what is the difference between refractory and relapsing lymphoma? So the answer is refractory is when you're being treated, and this is my layman's understanding, so please, if I am wrong and you hear me saying this and it's wrong, correct me down below. Refractory is when you're being treated and the treatment seems to be working. So that would be my case, right? All the blood work looks good. The last PET scan looked excellent. All the indications are that we're kicking lymphoma to the curb. And then either immediately post-treatment or towards the end of treatment, the treatment stops working. That would be considered refractory lymphoma, meaning, it like splashed back kind of. And relapse is just what it sounds like. So 2 months, 6 months, 2 years, 5 years, 8 years after you had lymphoma, you get lymphoma again. So that's a relapse. So that's, to my understanding, the difference between refractory and relapse is that in both cases, you responded to the treatment. In the refractory case, you were in the treatment and it seems to be responding and then it stops. Whereas relapsing, you had some period of time where you're NED, no evidence of disease, and then the disease comes back. One thing that was a little disconcerting to me in my research was that lymphoma, unlike a lot of other cancers, seems to have a longer period where it could come back or will come back. So as an example, when I had the ovary cancer many moons ago, 14, 15 years ago, when I got to the 2-year mark, the doc was like, yeah, I don't think this is coming back. And when I got to the 5-year mark, he's like, it is not coming back. You are done. That's not coming back. You're not going to have this type of cancer ever again. Like, he was adamant. And that's just the type of cancer. It doesn't relapse in that way, right? All statistically, the relapses happen under 2 years. And certainly everything is under 5 years. But that is not the case for lymphoma. It actually seems to be the opposite. I mean, there are relapses prior to the 2 and 5 years, but there could be relapses up to 8 years. And so that got me to thinking quite heavily that I think after this experience, I will always be a cancer patient. And I'm going to always have to be on top of any signs and symptoms that there's something going on in my body, which I think will be a little more challenging than usual. But I'm up for the challenge. Don't worry. And I think I am quite in tune with my body. All of my other cancers were found because I was listening, and I forced doctors to listen to me. So I can do it again. And even this cancer, to some extent, was found because I was listening, and then I went to the doctor, and they listened too. So we'll get there. But I guess, and I think I alluded to this a couple days ago in a discussion, the thing about cancer patients is there's all kinds of things going on in their brain, right? It's so far beyond, I think when we were talking about the positive attitude. So I am positive. I'm certainly positive. I'm positive I'm kicking this cancer's butt, and I'm positive that I have many, many years to live. But all this is playing in the brain. And you could certainly see if somebody was in a darker mood or less positive, that this could really drag you down. So these are all the things that are going on. Any thoughts? You think I'm in left field on this one, or am I right on target? I don't know. All right, so let's go on. How am I? I think I'm about the same. Still no surprising energy burst, unfortunately. So far as I know, no angel delivery, but we did have a lovely day overall celebrating my youngest birthday. We'll talk about that a little more on the to-do list, but it was a good day. And Dr. Nurse Lana came today and changed my PICC line dressing. All that looked good. There's no sign of infection or anything like that, so that's all a big thumbs up. So let's look at the to-do list I have a quick video of the cake I made for my son's birthday, so I'm going to play that while I'm telling you guys about the to-do list. All right, so I worked, I hydrated, I ordered the correct cake ingredients, I made the cake, which I'm sharing with you guys now. He wanted Cheesecake Factory for dinner, so Bill and I had a little date and drove over to Cheesecake Factory and picked it up curbside and brought it back for dinner on the deck. I did clean the kitchen a bit because Nurse Lana came for the dressing change. All right, my to-do, must-do list. Tomorrow, I must work, I must hydrate, I must do my Porridge Plus. And I need to load the dishwasher and run it. That might happen tonight, we'll see. My to-do would love to do is clean and my laundry. Same list as yesterday. I forgot to mention charity miles. So I did get a little bit of charity miles in this morning while I was unpacking the groceries and baking the cake. Not too much, not as much as I would like, but a little bit. Collectively, our team of 18 has moved 1,430 miles. Great job, team. And if you'd like to join our team, you can click, this is our team name, or there's a link down below in the description. Thank you so much, and I'm so proud of everybody for doing all that moving. Great job. All right, so if you just came for story time, thank you so much for joining us today. We will see you tomorrow. Let's move into daily symptoms and statistics. Love you. Remember, every day is a gift. Live it. See you tomorrow.